Hi, this is Amy. I'm just wanting to reflect on some of my wound care that I do through my job in the urgent care. We get a lot of lacs, bites, grazers come in to urgent care to be assessed and treated appropriately. In this case, I had a gentleman come in. He'd been hit by a bicycle while he was out jogging. 56-year-old gentleman that had no other health problems, had fallen really hard on his elbow, and he needed some stitches. He needed a good washout of his wound, and he needed to have an updated tetanus. So he had hypertension, which was being controlled by medication, but apart from that, no other past history, otherwise quite healthy and well, which is why he was running morning. He was a non-smoker. He consumed alcohol socially on the weekends. He lived with his wife, and they'd planned to retire down here. On all his vitals, baseline vitals were normal. On assessment of the wound, it did need a washout, which we did with some normal saline, under a bit of pressure and propulsion with the syringe. His pain was actually okay, so I gave nurse-initiated paracetamol on the onset of presentation. He said, "Oh, it stings a bit, but I'm fine. I'm really fine." There was no visual signs or cues. He wasn't moving his arm, so I was happy with that. I called the clinician on call and I said, "Hey, did my SBAR handover. Are you happy if we suture this wound and give a tetanus, and ask him to return either to his GP in 7 to 10 days or back to UCU for the removal of stitches?" The clinician was fine with that, and there was a training NP on site who was happy to come in, because I actually asked if I could be supervised with these stitches, just because of the frayedness of the skin. And although I've done my CINA suturing course, I haven't done a lot of suturing, and it's still a skill that I like feedback with. So this will be my fourth suturing job since doing my training. So I'm fairly confident on doing it for next time, dependent on the wound. So I just gauge by how I feel. So I was able to numb the area with lignocaine from the phone order that we both heard and signed in the appropriate medical chart. We knew there was no allergies as well. I'm not sure if I actually said that, but no allergies. Patient was happy with the plan. Patient was happy with me doing the suturing. We used a 4 nylon because of his skin, and I put 4 sutures in the back of his arm, which closed it beautifully. We did assess the wound. I should probably round back and talk about that. We made sure that I could see all of the bottom of the wound. It had stopped bleeding. There was no more foreign bodies in it, although we did explain the potential for infection with the nature of the injury. The patient was really happy to come back if there was any signs of infection, but at the moment he just wanted it fixed up. So that was where we went with it. I numbed around the site using the technique showed through CINA, sutured it. He felt really nice and comfortable, and then I just put a dressing on to protect it. And he actually presented for me yesterday, which was great, to have the sutures removed. He said that the tetanus injection had actually come up on his Medicare, which is the first time I'd heard that. So I believe our hospital now uploads things to AIR, which is new, which is very exciting. Usually we tell people to just keep a track of that. But that's a new thing that has come through, which is very cool. And he's had no issues with his arm, easily removed the stitches. He was super grateful for care, and he's back out running. So what a great outcome. It's still a collaborative approach. I asked for feedback after from the NPT, and she said she just found the gentleman really interesting talking to, and she was really confident with what I was doing. So that was really great. And yeah, that's that case. We do have a lot of these similar kind of presentations, so I feel fairly confident with managing these with consultation in the urgent care, which is good. And I choose the appropriate closure mechanism. I find that 50% are easily done with Histocril and no analgesics in my practice, and then the other 50% I do sort of feel I need to consult and just look at it a little bit differently, just to make sure that I'm giving the best care. All right, thanks.